Okay, entonces, ¿qué te hicimos? So what did we do?
Un aumento de busto.
Breast augmentation. ¿Y hace cuánto? How long ago?
6 semanas.
6 weeks ago. ¿Y qué tipo de implantes? What type of breast implants?
Silicona.
Silicone breast implants. ¿Y dónde te abrimos? Where did we open?
Por el ombligo.
Through the belly button. Wow. Y cuéntanos tu experiencia. Tell us your experience.
La mejor de las experiencias, no dolor, no sangrado,
The
no
best
morados.
of all experiences. No pain, no bruising, no bleeding. ¿Y cuánto estuviste caminando el primer día? And how much were you walking on the first day?
Una milla.
1 mile the first day. ¿Y el segundo día?
2 millas.
And the second day, 2 miles. And the third day?
3 millas.
And 3 miles the third day. ¿Y puedes ver la incisión en el ombligo? Can you see the incision on the belly button?
No, no se puede ver.
No, I cannot see it. So this is an incredible technique. ¿Y cómo se siente el busto cuando lo tocas? How does the breast feel when you touch it?
Se siente natural.
It feels very natural.
No perdí sensibilidad.
I didn't lose the sensation of the breast or the nipples, ni en el busto ni en los pezones. No, she did not lose sensation in the breast or nipples. Y ¿cómo se sienten los implantes? ¿Los puedes palpar o se sienten tan naturales que ni siquiera te das cuenta que tienes implantes? How do the breasts feel when you touch them? Can you feel the implants or not?
Los puedo tocar y
I
se
can
sienten naturales.
feel the breasts and they feel very natural. Wow. Okay, si quieres volteate de ladito despacito, so I'm going to ask her to turn sideways slowly. Fullness and projection, and you cannot even see the scar. In order to see the scar, you would have to lift the umbilical hood, which I'm going to do so you can see. So when I lift it, it's a tiny scar. It's right there. You can barely see it, but it's the size of my nail right there. It just goes in there. So many advantages of this procedure. The number one and most obvious is one single scar and the only natural scar of the body, which is the belly button. The size of the scar is literally about 1 centimeter in her case. Normally, if you were going to do this case, you would have a scar that is about 5 or 6 centimeters on either the inframammary fold, so up here about this big, or here about this big, or worse in the nipple or in the armpits. So if you add these two scars like that, it's gonna be a scar about this big compared to a scar that's basically the size of my nail, is hidden in that area beautifully, and much less risk and complications, because the bigger the scar, the bigger the wound, the more risk there is. So with this approach, number one, scarring is minimal. You can see that it's literally at least 10 times smaller, the scar. Why would you want to have scars on your breast, armpits, or nipples? I don't understand. That's a thing of the past, okay? For you, woman, you have to demand this procedure. Unfortunately, there is only a few doctors in the world that are doing this procedure. I was the first doctor in the United States, and I developed this actual technique that we do. And for you doctors, learn this procedure, because this is the way of the future, and our patients deserve better. The risk of bleeding with this procedure, especially with this modified technique for anesthesia, we have a risk of 0 bleeding from this procedure. And in May of 2020, and now it is January of 2026, we have not had a single case of capsular contracture, which is incredible. And these studies have been published by me, Dr. Gabriel Patino, and Dr. Jacob Hayabi, and Dr. Emma Ryan, who were the surgeons that followed me in the United States with this procedure, and dear friends of mine. So this is incredible. The risk of infection is less because the incision is small, and also because, especially if it's a big implant, pressing against an incision in the nearby area can cause edge ischemia or lack of blood supply to the edge of the wound, subsequent death or necrosis of the wound is a microscopic thing, and subsequent infection. So for that reason, no matter how big the implants that you put through the belly button, the implants are not going to be pressing on the transumbilical incision. So much less risk of infection, and the combination of these two factors, infection and bleeding, lack of infection, lack of bleeding, translate into lack of capsular contracture, because the most common cause of capsular contracture is precisely bleeding and infection. And with this approach, the risk of bleeding and infection is near zero. Therefore, the risk of capsular contracture is also near zero. So I have spoken about this in multiple academies since I invented this procedure. In 2021, I spoke at the American Academy of Cosmetic Surgery, and I presented this virtually because of the COVID restrictions at the time. And then subsequently, I presented this at the California Academy of Cosmetic Surgery. I presented this at the World Association of Gluteal Surgeons. And I'm now being invited in February. I'm going to the American Brazilian Aesthetic Meeting in Park City. I'm very excited about that. And I'm going to be presenting this very new technique. And we offer workshops for surgeons to come and learn this procedure from us here at the Cosmetic Surgical Center of Cerrito. So I would love to teach doctors, and I would love the woman to benefit from this procedure because it is incredible. And you can see our patients are raving about the procedure, and they don't understand why other women would want to do this procedure with scars and the extra risk. The risk of puncturing the lung with this approach is near zero, because the lung is usually punctured by the electrocautery that heats up the pleura, which is the covering around the lungs, and that's how a punctured lung happens. Zero incidence of internal injury to the lungs or to the abdomen. Zero incidence of implant rupture during insertion, because I invented this procedure and I advanced the implants manually with my own hands. So it's a non-traumatic insertion, and also a non-traumatic dissection of the pocket, which we do with what is called hydrodissection. So I dissect the pockets with your own anesthesia fluid, which is normal saline, 2 milligrams of epinephrine, and lidocaine, 2% lidocaine for those doctors watching out there. And I think this is just incredible. I'm very thrilled, and I would love you to benefit from this procedure. Please give us a call. Thank you.